So very happy to say the next talk is Bruce Johnson from the Mayo Clinic. And the title of this talk is Volatile Organic Compounds and Exhaled Breath Reflect Physiological Changes in Ultramarathon Runners. Bruce is a professor of medicine and physiology at the Mayo Clinic and directs the Human Integrative and Environmental Physiology Lab, as well as the Institutional Energy Balance Core Laboratory. He pursues studies in clinical, environmental, and human performance physiology with a general interest in the limits of human performance and adaptation to unique environments. And Tina will be joining us for the Q&A session at the end of this.
Well, greetings. My name is Bruce Johnson, and I'm a professor of medicine at Mayo Clinic in Rochester, Minnesota. This project I'm going to present is a collaboration with our colleagues at Owlstone, and the focus is on volatile organic compounds in the exhaled breath in ultramarathoners. So just as a little context and background, our laboratory that we call the Human Integrative Environmental Physiology Laboratory really has three swim lanes: clinical physiology, environmental physiology, and human performance physiology. And a real focus area for us over the last maybe 20 years has been the limits of human performance and adaptation in extreme environments. And so we've sort of circled the globe working with unique populations. And we have sort of two goals. One is we think there's things we can learn from these unique populations, sort of pushing the limits of human adaptation that we can bring back to clinical practice. But also we've been interested in sort of this dose response curve for adaptation, and that is, where is that edge between adaptation versus maladaptation, and what are the circumstances that allow people to continue to push these unique limits and boundaries. So what are some of the challenges of an ultra-endurance exercise event? And these are just some of the physiologic conditions. There's many others and more mechanistic ones. But from our perspective, there's high and sustained cardiac output. So there's high turbulent flow circulating through the bloodstream. This affects preload and afterload on the heart. There's evidence that the right and left hearts may be differentially affected. There's prolonged elevated heart rates, high catecholamines over time. This can affect vascular permeability. In up and down events, there's a lot of eccentric muscle contraction, which releases free radicals, causes oxidative stress, and contributes to inflammation. There are challenges with fluid regulation, ultrastructure changes, and tissue breakdown. There's often consistent high calorie intake in these people, and many times what I would think would be inadequate recovery times, especially as people get older that continue these events. Our interests in this event were more respiratory, but we're looking at the effects on the human physiology in general. But from the respiratory standpoint, these people have prolonged elevations in ventilation. There's often sort of turbulent air that's cold and can be dry. There's heavy prolonged use of respiratory muscles, both the diaphragm and accessory muscles. Parenchymal stretch can trigger inflammation. There's, again, high and sustained cardiac outputs, but essentially the entire output of the heart, which may go up to 25-30 liters per minute, has to go through the pulmonary circulation and be absorbed by the capillary structure. Some studies have suggested possibility of stress failure in the capillaries. And then with altitude changes, this can cause pulmonary vasoconstriction and alter the load on the right heart, and also cause fluid exchange into the extravascular space. This is just a diagram of the lungs, and there's the upper airways. It divides into maybe up to 23 smaller airways, which end in the alveolar area, where gas exchange occurs and where essentially air and blood meet. And this surface area is huge, and there's just very micro structure, probably 2-3 cell layers that divides the two. And it is a big capacitance and usually a low pressure system, but high cardiac outputs. And again, if there's altitude changes, it can change vascular resistance. So then this leads us to our introduction, or our goal of the project. Exercise, or exhaustive exercise, can thus induce unique physiologic responses in the lungs and other parts of the body, and thus it is reasonable to postulate that lung injury may be occurring in the areas or near the alveolar capillary membrane. This was our primary focus. Volatile organic compounds in exhaled breath are ideal for studying the effects of exhaustive exercise on the lungs due to the proximity of the breath matrix to the respiratory tract, as well as because of this large surface area of the lung for gas exchange. As breath VOCs can originate from airways or bloodstream, changes in abundance should also indicate broader physiological effects of exhaustive exercise on the body. Currently, there is limited published data on the effects of exhaustive exercise on breath VOCs. These have been typically with acute and very short duration exercise protocols. So this is really one of the first studies to explore breath VOCs in ultramarathon. And so again, the objective of the study was to evaluate VOCs in exhaled breath at different abundance between matched pairs of samples collected before and after the Ultra-Trail du Mont Blanc ultramarathon. And this is just a picture of what this looks like in Chamonix, France. We set up a lab there over 2 years, 2018 and 19. The data presented here are primarily from 2019. This is a fast-growing sport, and really one of the most famous of races is the UTMB. So there were a total of 24 participants that gave breath samples using the Reciva breath sampler from Owlstone. And most of these people did this within 24 to 72 hours prior to the race and relatively soon after participating. Due to the difficulty of ultra-trail events, subjects were not requested to fast prior to giving samples. However, dietary intake 3 hours prior to breath sampling was documented. You can see these are primarily males in their late 30s, low BMIs, as you might expect. And, a fair number of them had coffee or citrus drink or fruit. What did we find? This is an overview of the VOC data. And this is fold change and p-value. And a total of 793 VOCs were measured in breath samples of elite runners using high-resolution GC and mass spectrometry. After correction for multiple testing, 63 VOCs showed a significant difference between pre and post samples. 12 decreased, 51 increased. And of the VOCs that reached significant differences in post-race samples, 18 had identified, matched to the breath biopsy library, which is a library that Owlstone is developing. Several of the VOCs reflect physiologic changes in exhaustive exercise. These are just 7 of these. Isoprene, 2,3-butadiene, 2-butanone acetate, acetone, 2-butanediol, and 2-heptanone. And this just shows the fold change. We did some review of the literature. for how these VOCs might be linked to this event. And we know that increased levels of acetone suggest lipolysis, while increased isoprene has been proposed to be released from working muscles at the onset of exercise. Interestingly, isoprene has been shown to be reduced after in people with respiratory distress type syndromes. So it's interesting that it increased, although there are multiple sources. Studies suggest mixed results regarding exhaled breath isoprene and acetone levels after exhaustive exercise. Increased levels of ketones, 2-butanone and 2-heptanone, could be a result of utilizing lipids as an alternative energy source during exhaustive exercise. It can also suggest inflammation, which is associated with the oxidation of membrane lipids, resulting in the final production of ketones. And increased levels of acetate, 2,3-butanedione and 2,3-butanediol, which are products of microbial fermentation, suggest the effects of exhaustive exercise on gut microbiome activity. And acetate has been shown to be an energy source under extreme exercise. So in conclusion, this is the first study that explored breath VOC changes in ultramarathon runners, and the study demonstrates that there are differences in exhaled breath VOCs between pre and post race. A total of 63 VOCs showed significant differences between pre and post race samples. 12 decreased, 51 increased. 18 VOCs had identities assigned from the breath biopsy library. These VOCs potentially reflect various physiologic responses to exhaustive exercise, including fatty acid oxidation, inflammation, and altered activity in the gut microbiome. We're continuing to explore these exhaled VOCs and starting to link them to some of our physiologic measures we took pre and post exercise. And so anticipate additional data to come. Thus far, we haven't found a clear signal that would align with lung type injury, but again, those data are pending. Thank you very much.
So we've only got a few minutes for questions. So again, quick reminder, everyone, post it in the Q&A at the bottom. I had one quick question. So it was interesting seeing some of the VOCs potentially relate to the microbiome. During ultra running events, the participants are obviously taking on quite a lot of nutrition. Do you think there's a kind of interplay there between the nutrition that's being taken on during the race and some of the observations that are made in this particular study?
I would think that, yeah, definitely nutrition would be a factor in contributing what metabolites are measured through that are generated from microbials. However, in this case, not exactly sure the detailed nutrition that were being recorded. We know that there are citrus fruit that we paid attention to, and as well as coffee drink. And in the ultramarathon case, it's quite unrealistic to restrict any food intake just because the amount of energy that they need that has to come from these nutrition sources. So yes, I agree, definitely there are some impact. However, it will be hard to control or sort out in this study.
Yeah. I was just curious because I know a lot of the times it's extremely simple, high carb foods, gels, those types of things as well. So I was just thinking about some of the talks earlier in the day, some of the upregulated VOCs there. The next question we have here is, what were some of the challenges and limitations in sampling the subjects in this study?
Yeah, there are actually several challenges and limitations. So in terms of recruitment, it's hard to control like a very balanced gender or age population. So in this study, it's heavily leans towards male subjects. There's only 3 out of 24 that were female. In terms of breath sampling, because all the subjects have different finishing, they have different paces, so they finish at different timings. And after they finish the race, there could be some recovery or other post activities before they come and give their post breath sample. So the post race, after they end the race to when they give breath sample, is distributed from 1 to 3 hours, which could have affected their physiological changes and could have been a factor on reflecting why we see moderate separation between the pre-post race samples. So this could be a factor that is unfortunately a limitation in this case.
Great, thank you. Next question is, could some of the microbiome associated VOCs also originate from bacteria that occur within the respiratory system rather than the GI tract?
Yes, it is possible, but in this case, we won't be able to separate or have more conclusive origins without other additional metadata, such as like their the additional metadata that has been captured. So we will need more information to know that.
Great, thank you. Next question is, I wonder if there's a gradient in VOC concentration that changes from mild to strenuous exercise.
That's a very good question. I would think so. Mild to strenuous exercise. So is that more like?
I would imagine going out and running 4 miles versus running the Ultra Trail de Mont Blanc.
Yeah, I guess that will make sense. Like if you're exhausting yourself, you won't require like alternative energy sources, so you will be like metabolizing more lipids and generating certain compounds. So yeah, I guess it's possible. It would be a very interesting study to do.
Yes, the next question is kind of related to that. So for these axial VOCs, how would they generalize to non-elite population? I suppose just need to do the studies, basically. We have the starting point now.
Yeah. I mean, in terms of non-elite, I mean, if you can finish running 100 kilometers without stopping, you're kind of elite. It's more so on how long it takes you to finish the ultramarathon.
Yes.
That would be interesting to measure, and how fast you recover after you finish that, because everyone is kind of different.
Great. And
so I guess that's more on the training levels.
Yeah. Brilliant. And then we have time for one more question. So this is a question about halitosis in the 5 runners after but not for the event. How long did that last?
That is a very interesting question. I'm not exactly sure because of the way how we recorded halitosis. It's more based on a yes/no question from the individuals that are giving breath samples, or the person that's taking, if they feel like there are odor coming from their breath that they record, they might be suspecting halitosis.
Got it. Excellent. Well, we've got to leave it there. Thank you so much, Tina, for coming on to answer those questions. Really appreciate it.